So in this video, I'm going to talk about the basics of back stabilization. And this first posture is extremely important because this is how we're going to build the core to stabilize our lower back. Okay, so if we've reviewed back stabilization exercises in the past, this is a good one to even go back to because many times people come in for follow-ups and they've kind of lost this pelvic tilt and they lost this core stabilization. And this is what it's all about. Okay, the arm and leg movements don't mean anything. They're just making this harder to hold. So this is extremely important. So I'm going to lay down here. Now we want to find what we're calling a neutral spine. So we don't want to be in poor posture here, but we also don't want to be extremely arched here. Okay, some people have too much arch, maybe 20% of the population. We want to find this neutral spine. Okay, so we may not want to be flat into the table, so we're going to use this towel here. So if I lay down here and I make this natural arch, okay, normally I have people with their hands at their side, but I want you to be able to see the towel and what's going on, okay? So right now I'm relaxed. If I put my legs out, now I'm making more of an arch because I'm pulling this way with my pelvis. So I may want it to be more stable and flat, so I'm going to bend my knees, and then I'm going to tilt my pelvis back into the towel. Now I'm not going to go all the way, and then my butt comes off the table. I'm going to come about halfway, okay? And I'm pushing down into the towel, but I'm not squeezing or bearing down. This is a motion with the pelvis, okay? Pelvis is rotating, okay? So, and this is extremely important because people lose this stability and then it hurts their back because then your vertebrae are shifting if they're not being held stable. So pull back about halfway. Okay, now I'm stable, so I'm going to hold this first, okay? I might hold this 5 to 10 seconds. If I can't hold this, I'm not ready to start these movements, okay? It's extremely important. So I relax, take a break. Now I'm going to tilt back. Okay, now I'm ready to see if I'm stable. Okay, if I'm stable, I should be able to lift one leg off slowly. People always do this too fast. Should be able to lift the other leg. Now when the legs go down, now I'm ready to relax my back, okay? If you don't have a tilt to let go of, you lost it somewhere in the process, okay? So you don't have the strength or maybe the coordination. So don't progress past this if you don't have this down. So again, pulling back, now I'm stable, now I can lift one leg up and then the other leg, okay? Now sometimes, and now I can relax my pelvis. Sometimes what we see is people can get this, but then when one leg goes out, their hips will rotate or drop. I'm exaggerating, but the hips will rotate, and then you'll see them try the other side, and it rotates the other side, okay? So this is 3D, all these muscles in here, 3 dimensions, so we got to watch rotation too. So, and to watch that, I can put my thumbs on my hips to feel that. Tilt back first, lift one leg, and then the other leg, and then I'm going to relax, okay? This has to be perfect. If this isn't perfect, don't progress to the next stage, okay? You could spend weeks doing this to get this perfect. We have many patients who don't have the strength to do this, okay? Now, as you get stronger over the weeks, okay, you start to tilt back, hold. Now you start to go out longer with this lever arm, which is torquing on the back even more, but it should be okay because you're stabilizing with these stomach muscles. Okay, maybe I'll do 2 reps. Oh, and back to the previous one. If I'm only here, then I might work up to like 6 reps before I have to stop, okay? 8 reps, 10, 15, 20. Once you get up to 20 and this is rock solid for a whole set, then you can start progressing. Okay, so now you're making the lever arm longer, so now it's going to make this harder to hold. So stabilize. Now I'm ready for the next progression, which is legs going out here. Okay, then you add numbers, you do, even numbers up to 20. Okay, and then relax here. Okay, after a couple weeks of that, now you're looking at the opposite arm and leg. Okay, so tilt first, one leg goes out and the opposite arm goes overhead. This takes a lot of coordination, takes practice. Okay, but you want your core to be rock solid, stable, so that later when you're standing up and lifting things or moving around, you're not going to be in so much pain. This is how you keep everything stable. If you want to progress even more than that, then you're putting on ankle weights. You have a dumbbell, but don't go crazy, okay? Still, this is the most important part. So, keeping it very stable. You could add weights later and do that sort of thing, okay? So that's the basics. That's the most important part. Stuart McGill, the guy who did all the research on this stuff, he has an exercise called the McGill curl up, but most of the patients I see can't do that. This is what I'm doing is, I wouldn't say remedial, but I like it better because I think I'm teaching this perfect stabilization first. Okay, but I'll show you the McGill curl up. Most of my patients can't do it. It is hands under the lower back, stabilizing, one knee bent, one leg straight, okay? And then you slowly lift your shoulders up, and I can feel my abs firing, okay? Some people can handle this. I mean, this is a very good exercise, but for people who can't handle it, it's not always the best option. A very important point that McGill found is that he studied all the muscles around the spine, and he found that when they're stabilizing us, they only work at 20%. They're not working at 100%. So when we were kids and we're doing sit-ups, we're firing 60 to 80%. That's not how our core works when it's protecting us. It's actually about endurance, and it's not about strength. So he was looking at the all-day endurance. At the end of the day, when the endurance of these muscles goes out, that's when people are having problems. So the reason I say that is because when you're doing this exercise, you're not bearing down as hard as you can. I'm just lifting up and creating tone and endurance in these muscles. So I may hold, let's say, any of these exercises, 6 to 8 seconds, and then I'll relax 6 to 8 seconds. And then I'm going to keep repeating this, okay? And that's how I'm going to make my core stronger, but we're really talking about endurance, okay? We'll lose a lot of people if we say endurance, but I think that is the more correct term. So we always say strength, but we're really talking about that. Thanks for watching. Please subscribe and share.